More on the pressures on the NHS. The Health Secretary, Jeremy Hunt, has denied the health services in crisis. So what do those on the front line think? Dr. Kishan Rees is an A&E doctor at Lincoln County Hospital, and he joins us now. Hello to you. Thank you for joining us. What have you made of what we've heard from the Health Secretary over the last couple of days?
OK, so I think it's very interesting, isn't it? We've had thousands of junior doctors as part of a junior doctor movement from October 2015 screaming out loud that you are struggling to provide a 5-day service and you can't stretch 5 days over into 7 days without significant problems happening. And I personally am just pleased to see that the Red Cross have come out and said what they've said, and it's generated a lot of media attention because up until this point, we have been ignored by swathes of the mainstream media, which is, to me as a doctor, is concerning in terms of patient safety.
Why is A&E so full at the moment?
I think A&E is full because we're seeing cuts to GPs, patients have difficulty getting GP appointments, social care budgets are being slashed left, right and centre, and I think lots of patients are coming to A&E basically because it's their last resort and it's a safety net, and they don't want to come. They feel they don't want to cause burden or difficulty to doctors, and we've got to be very careful with messaging, or I suggest the government are very careful with messaging, saying you should avoid A&E. I saw the Daily Mail headline this morning, A&E crisis, it's your fault. As a doctor, I feel very uneasy with that, and I think we should be very careful.
And 4 hours waiting time is what we're hearing about. What is the reality?
So 4 hours, I mean, it's very interesting yesterday, isn't it, that Jeremy Hunt said that they were talking about redefining the 4-hour target. I would suggest that if you have hospitals across the country that are appropriately staffed with enough resources, then the 4-hour target is deliverable for all things. And I'm concerned that should we really be starting to move towards a 2-tier service? I mean, Jeremy Hunt has written in the past that the ambition of the Conservative Party should be to denationalise the provision of healthcare in the UK, and this is something that the media has not really taken on board. Is that what the public want? Do the public want to move towards an insurance-based model? I would probably suggest not, as a doctor. But we need to have these discussions, and I saw one of your reporters was chasing Jeremy Hunt down the street. We need politicians to be talking live to the public and on matters as important as health. OK, but just to clarify, 4 hours, what's the reality? How long are people waiting? Well, I think lots of doctors and nurses are working hard across the country to get as many people in as possible, but yes, people are breaching all over the country from the 4 hours point of view because the NHS is stretched. OK, good to talk to you. Thanks very much indeed for joining us. Thank you. Still to come on the programme for you this afternoon.